Let us know when we're good to go. Well, as we can see from our COVID numbers today, we've recorded over 9,000 new cases again, with 6,444 of those being results from rapid antigen tests. And we can see that more and more people are also coming out with 4 PCR tests. So we've had 16,802 PCR tests in the last 24 hours. And looking at those numbers, we're still seeing probably 1 in 4 people who are coming forward for PCR tests are showing up positive. So I do want to thank all of those individuals who continue to isolate, to undertake tests, either going to testing clinics or by doing a rapid antigen test at home, and who are also quarantining. What we do know is that we are in the middle of a second wave of Omicron. Now, we're not sure when this wave is going to peak, but we expect sometime in April. Today, the Chief Health Officer and myself have met with the Premier to brief her on the current wave and what we are seeing as far as the number of cases. And in fact, currently, we have now recorded over 2,400 health workers are now furloughed again. Now, at the start of this week, that was down to 1,600, and of course, we know that's gone down to 1,200 in the past. So we are seeing a doubling of the number of health workers, even though we're not seeing an increase in beds at the moment from COVID patients or in ICU, which is very positive. But we are still seeing pressures in our health system right now because of the number of health staff who are either positive themselves or are needing to quarantine because they're in a household with others who are positive. And we know many of those are school-age children. So based on the meeting and advice we've received today, we are not changing the settings that we currently have across the state. Those settings, of course, relate to mandatory vaccinations and of course, access to venues around vaccination, but also around workers. And we are not changing the setting in relation to people having to isolate or quarantine and the length of that quarantine or isolation. We will review this at the time that we come off this wave. Again, we expect that in April, but we can't give a definitive date as yet because we will continue to monitor this closely and also keep working with our interstate colleagues as to when they expect to see their peaks, because we know that historically over the last 2 and a bit years, Queensland follows New South Wales peak around a week or 2 later. I do want to say that with the fact that we're seeing another wave, that we're seeing such a large number of children showing up positive, that we are a week away from school holidays. Our vaccination clinics will be open over school holidays, and of course parents can still access pharmacies, as can adults, and particularly those in their 20s who are due for their boosters and haven't come forward yet. Please take up this opportunity. But in addition to keeping our vaccination clinics open over school holidays, we will look to establish some blitzes of vaccination clinics on school grounds when school goes back in that first or second week. So we'll work with the Education Department and Health as to whether we're best to do that after school, late afternoon or on a weekend, as to what best suits the parents to make it as accessible as possible. But we do need to do this because we do need to lift the vaccination rates for our young children, and we want to make it as available as we can for parents. But can I say to parents, please don't wait to the start of the next school term. If you can, please take your child to get vaccinated over the school holidays. And I remind anyone who's due for their booster to come forward. Now, the Commonwealth has announced today that there is a 4th booster available for certain categories. That is people who are aged 65 years and older. If you are Aboriginal and Torres Strait Islander person who is over the age of 50, residents of aged care and disability care facilities, and people aged 16 years and older who have severely immunocompromised should receive this dose what they're calling a winter dose to maximise their protection if they've had 4 months passed since they had their third dose. So we'll continue to support GPs and pharmacies and to ensure that those boosters are available. Of course, it is a Commonwealth responsibility to make sure there is enough vaccine now to accommodate this fourth booster in our primary care settings. We will be winding down our vaccination clinics because after we get past school holidays, that will put around 730 health workers back into the health sector, both public and private, and we believe that that's important to make sure that we can continue to manage our health sector, and also because of the reduction in demand in those areas. We do want these vaccines to become more normalised by people going to their GPs and to pharmacies as well. So if you are in any of those categories, you can come forward right now if it's been 4 months since you've had your third booster, based on ATAGI's advice today. And I understand the Commonwealth also indicated that they are removing the requirement for pre-testing for international flight arrivals. Again, this is a national decision. Certainly we are supportive of that decision being made. What is important is whether people are vaccinated or not, and if they're not vaccinated with a vaccine that is recognised by TGA, that they're still quarantining at this point in time, and that's why we have the WellCamp facility. But we believe that whether people are doing a test or not before they get on planes will have minimal impact on transmission once they arrive here. I'll now hand over to the Chief Health Officer and then we'll take some questions. Thanks.
Thank you very much, Minister. So it's now very clear that Queensland is well into a secondary Omicron wave due to the BA2 subvariant. Case numbers of COVID infections have increased in Queensland by 54% from baseline 2 weeks ago. And numbers are increasing across all age groups. Of interest particularly are school-aged children. About 1 in 50 school-aged children have tested positive in Queensland over the past week. Another interesting observation is that 47% of cases that we are seeing have lived in the same household as a primary case. So clearly those household contacts are critical. 47% of positive cases are from the same household as someone known to be positive, hence the critical nature of that close contact in the household environment. There is no clear indication at this stage when this wave will peak. It's a bit too early, we haven't got enough data. It will be sometime in April, but exactly when we still don't have enough data to determine. Importantly, so far we have not seen any increases in hospitalisations, and that is because the vaccines are very effective in preventing severe disease. Now we know the vaccine's effect in preventing transmission of this virus diminishes over time, but most importantly, the vaccine prevents severe disease. And when I say severe disease, I mean infection that results in hospitalisation, intensive care admission and death. So I remind everybody the most important thing, of course, is to get vaccinated. Get your children vaccinated, because this is spreading among young children, as I've said. About 1 in 50 Queensland school-aged children has had this infection in the last 7 days. Get that third dose, the booster, if it's more than 3 months since your second dose, and you'll be entitled to a fourth dose if you're over the age of 65, and it's 4 months since your third dose from the 4th of April. We do not at this stage plan to change any of our public health settings at this stage. We are expecting this virus to continue to spread and occur in waves like this. This is exactly what we expected. This wave is perhaps a little earlier than might have been predicted, but we've always known there would be further waves. And this will be the future for months and years to come. and we're not going to overreact every time there is another wave of the virus. With regard to infections in schools, we're not implementing any specific mandates with regard to public schools, because all schools are somewhat different. It depends on where those schools are. But if there are significant outbreaks in schools, we encourage the headmasters, mistresses to implement a mask mandate if it's required in that particular environment. But we're not mandating that specifically for schools. It all depends on the individual schools. So the individual staff, the leadership of the schools can make that decision themselves. Thank you very much.
Minister, so you're fully on board with everything that Atagi says, obviously follows Greg Hunt, the federal government today?
Yeah, look, we from day one have followed the health advice and will continue to do that. If Atagi thinks, based on the international evidence around waning efficacy and immunity, that it is essential that we bring in a fourth booster for these groups, then we should do that. That's, we have to follow the health advice. That's what we've prided ourselves on. And so, we do know that this virus can be impacted more in colder weather, colder seasons. So we don't know if what we're seeing now is the winter surge or whether we're going to have another one as more people start seeing flu symptoms as well. And we've got to be really careful, because people will start getting the flu in winter and may very well just start assuming that that's what they've got, when it could be COVID, and they could be having another case of COVID. So we will follow the advice. This is the advice, and we will, work with the government. I mean, my only query, I guess, having heard this morning, is hearing from the Commonwealth what their strategy is to get residential aged care vaccinated and disability, because we know that it's taken some time to get residents boosted with their third. If Atagi is now saying that these individuals are such in a vulnerable state that they now need a fourth booster, then what is the Commonwealth's plan to roll that out?
We always talk about the vaccine being apparatus protection. If we're talking about the BA2, there's 150 million doses of vaccine currently available here in Australia. Why not the Queensland government just say, look, we know we've had two, everyone's done quite well, but we think we need to put a mandate on the third to give us an extra layer of protection, because for many people, they were probably sitting at home going, had it, and I'm all right, don't worry about it. When you can actually contract BA2 again, and it starts to spread, why not just say, right, Queensland, when you're eligible, you must come forward and get it?
Well, look, at this stage, the advice is we don't need to go down that path. We have, we have measures in place already around the mandatory vaccinations. And yes, that relates to two vaccinations. But my message to anyone, if you've been willing to come out and get your first and second COVID vaccine, it really is crazy to avoid getting your booster, because we have, and the Chief Health Officer particularly, has stood up since December, since we've had the Omicron wave, and given the breakdown of the number of people who have ended up in hospital or ICU or who have passed away with COVID, and the breakdown of who's had boosters or not. We know boosters make a difference with Omicron. Could not be clearer. Whether it is mandated or not, I would have thought it would be incumbent on everyone to keep themselves safe and their loved ones. And the Chief Health Officer has just said 47% of the people coming forward who are positive right now are catching it from someone else who's already positive in their household. So get your booster. And I know there's a lot of 20-somethings. I've had the conversation with my children. They're due for their boosters. Go get it. If you've recently had COVID, once your symptoms have passed, you don't need to wait. If you're eligible, go get your booster.
Well, the issue of school, you talked about doing a vaccine for school kids in school. You said after school.
Yes.
Why can't you do a thing where the commission slip goes home to parents sign it, and you have someone that comes in during school hours
Because
and
we're
classes line up
and that's how we do the normal immunisation program with our school kids. However, we're talking 5 to 11-year-olds specifically, and the advice from paediatricians is that it is best that their parents accompanying them because they're very young in age. And so we absolutely respect that advice, and That's why we want to make it as convenient as we can for these parents. I would prefer they come out over the school holidays, but if it is likely that we're going to be able to boost the numbers by putting them at the schools after school time or on a weekend blitz again, that's what we'll do. We'll also be looking at an advertising campaign again to encourage parents to get their young children vaccinated, and also booster shots, and especially since the announcement today. So.
How many state school staff are currently in isolation?
I don't. I look at my health staff, each day, and as I say, it's. Right. I'm happy to follow up with the Education Minister's office around how many are furloughed currently. But look, we know, and I can very confidently say, based on the last wave and also what we experienced previously, including the Indooroopilly cluster, many of my health workers that are quarantined right now is because they have young children. And so we've got one more week of school left before school holidays. Take this opportunity, get your children vaccinated, because we know that there are a lot of children getting COVID right now, and although those children might not be getting seriously ill and needing hospitalisation, we do know that they're passing it to other family members, and we want to make sure that we're protecting everyone in the community as much as we can. Pardon? So we will. So we'll do the same sort of analysis as we've done before. I'll look at the heat map of where is our lowest numbers of 5 to 11-year-old vaccinations, and where do we think we need to concentrate, because we can't put them in every school. It still takes a lot of resources to do these pop-up clinics. So we'll be looking at where we do it and the frequency. Sometimes it's easier to just do a big hit for one weekend, Saturday and Sunday, over a large number of schools. We've done 100 before, more than 100, as opposed to a number of afternoons. So we're just looking at that and what is going to be the most convenient thing for families, and where's the greatest need and the lowest numbers of child vaccination. I might ask the Chief Health Officer where we're at with the flu numbers, but of course April's when we start going out strongly and asking people to get the flu shot, and that's when the flu vaccine will start arriving. And I noticed the Commonwealth have made an announcement of financial injection for more flu vaccines being available. So, we'll look forward to that arriving, and don't worry, you'll be hearing me standing up talking about flu vaccines soon enough, but I'll hand over to the Chief Officer.
We're not seeing much influenza here in Australia at the moment, but of note, for example, France is seeing quite a substantial epidemic of influenza out of season for them, and usually if we see substantial outbreaks in the Northern Hemisphere prior to our winter, we can expect that to happen in Australia, but we don't know yet. But given that it's being seen in Europe, there's a reasonable chance that we'll be seeing something this winter.
Again, it's a staggering figure, 150 million doses available. You find it quite strange that why don't they open the books to everybody? If the fourth dose is protecting us, I know they're doing wonderful, but why not open the door to all of us to come forward and get a full shot?
Well, that's on the advice of ATAGI. ATAGI gives that advice. We know that the older age group is particularly vulnerable to this infection because of the changes that occurs in the nature of our immune systems at that after. It starts at the age of 40 but changes further after the age of 60, 70. So if you look at our data, as you'd be well aware, most of our severe cases are in that age group.
They also mentioned an annual shot a COVID shot for all Australians. Do you think a good idea in your medical opinion?
I think ultimately we'll take the advice of ATAGI. It seems likely, but that will be the advice of ATAGI.
There was no advice from ATAGI, that was actually the federal government's report planning.
I think it's a good idea to plan for that, but we won't know for another year or so. Yeah. Yes. Yep. No, all I'm saying is we can expect to see increases and decreases, that this virus will wax and wane over time. So we're not going to suddenly increase the public health measures because we're seeing the increase in a wave. So just because this is going to continue to happen over time. But that's all I meant.
Just to follow up on that for the health minister. So the government said it was going to review the vaccine mandate and the provisions around that, and assuming today is that decision that it's not changing. Yep. Given what Dr. Gerard has just said about how there's going to be increases and decreases, and you have said we're not going to change the rules around it because we're seeing an increase. If we're going to continue going forward seeing increases and decreases, is it fair to assume that you're not going to ever change the rules around the vaccine
No,
mandate?
that's certainly not what we're saying. What we're saying is that, this is still early days. This is a second wave for us. It's still prior to winter. So, after we started coming off that big wave of Omicron in January, February, we said we are very interested in what's going to happen in winter and what the impact of the flu as well as potentially another wave of COVID might do to our health system. We haven't hit winter yet, so we're conscious of that. And of course, this wave's probably come sooner than we were expecting. And again, we don't know if this is the winter wave or not. What we don't want to do, and the Chief Health Officer just made this point, we don't want to jump too quickly, pull off the mandatory vaccinations and the other rules around quarantine, only to find winter's going to be really bad and put it back in place. I think that would be a lot more damaging to business, to the economy, and to people's confidence in the decisions that we're making if we're constantly pulling these provisions off and then putting them back on again. We've been really careful to do this in a gradual way, in a safe way based on advice, and we think at the moment that we are best because we've come into a new wave so quickly after coming off the first wave to just see how this progresses, and we will review this in April as we come off this wave. We're given that commitment. Look, we're not saying that. We're not saying that at all. We're saying we will absolutely review these as when we come off this wave to see if there's any more changes that should be made, including any advice from AHPPC around the quarantine requirements as well. But at this stage, there's no change. Well, normally we don't announce. So the process we completed some time ago, but because these appointments don't expire till the end of March, we normally don't announce the appointments until close to that date, because we want to make sure that everyone, and there'll still be one vacancy on the Northwest Board. So simply because of changes since people first applied. And change in circumstances, so we'll go through the process of filling that extra vacancy. But yeah, this is a normal process where we normally announce them close to when the expiry of those appointments. But I welcome all of the new appointments. I know I've got a number of new chairs as well, but I'm really pleased that I've got a new board coming in, headed up by Cheryl Varden at Northwest. I think that will be really promising to work with them about how we improve the services across that area. Mm-hmm.
What does that mean for the health system? Are there going to be any changes that we can expect?
Yeah, so I'm checking the tiers that the hospitals are sitting on at the moment. Some of them fluctuate at a local hospital level, from time to time. An individual hospital within a HHS might go back up to Tier 3 from Tier 2, which means, they'll be looking at how they might take pressures off other areas to concentrate on, particularly the shortage of staff. But at a HHS level, there isn't changes to those tier levels, so we're not seeing them step up and escalate to 4s, for example, unless they were already at a 4. What it means is they're probably not coming off those tiers as I might have hoped. If this wave hadn't have happened, I would have expected more of them to be coming onto Tier 3 and Tier 2, but that's not happening now.
Can I just,
Sorry?
I'm hoping to just make one more comment.
One more?
Just sorry, if you don't mind, just about the waves of pandemic in this particular question. Our experience and understanding of pandemics is largely based on past experience with influenza pandemics like the Spanish flu, Asian flu and Hong Kong flu. And we've known with those previous pandemics that a series of waves follows on for some period of time after that initial wave. But as time goes by, each wave gets less and less. So the fact that we're having a secondary wave now was always expected, or was always expected we'd have it at some time. It's likely to be less than the last one, and as time goes by, that is likely to be what happens. And it may take a period of years, and it's likely that after a few years this coronavirus will get into a seasonal pattern rather than random waves. That's the general belief among epidemiologists about what's going to happen. Okay, thank you.
Thank you. Thanks, Mikey.